Michael, good afternoon. Newton Odoro, Yuka Beth Momani, just confirm you can hear me. Just confirm you can be able to see the screen. Kevin Mutai, good afternoon. Good afternoon, everyone. Good afternoon.
Yeah, we can hear you,
Hear
Frederick.
me? Good.
Sounded
Good.
clear.
Nice. Wow, I can see everyone. Everyone, welcome. Joshua Mwenga, that is my classmate there. John Kilu, welcome. Flora, Marion, Wakulunya, welcome. Yeah, you can say hello there. We will be going live at exactly 3 p.m. We'll be going live at exactly 3 p.m. Evelyn Makisa, welcome. Angela Muema, welcome. Wilson Korir, welcome. Stephen Morocco, welcome. Yeah, welcome everyone. Welcome, welcome, welcome. We are glad to be here. This is the Lab Medicine Society of Kenya. Welcome everyone. We will go live at exactly 3 p.m. We'll go live at exactly 3 p.m. If you have people who say that they have registered for the meeting, we have pinned the meeting credentials. That is the webinar ID on our WhatsApp group. Let them use that to join on Zoom platform. So we have pinned the meeting credentials. That is the webinar ID and the password. They can easily just join through that. So another important announcement is that we have not closed the payment form. You can still register. And of course, this webinar will attract 3 CPD points that is accredited by KMLTTB. So we are, the window is open still. You can still register and join. So as I've said earlier that this is a webinar on Zoom platform. We have pinned the credentials on the group, so anyone can join. Tell your colleagues, those who want to join, that they should join. Again, remember to use your official names. If it is Angela Nyaboke, let it be like that. That is how we shall mark the attendance register. Don't use the name of your phone or any other. Yeah, Danson Murimi, I hear you. You are saying the registration form is closed. Yeah, but you can attend. Once you've attended and we mark you present, we can always have that discussion because you attended the discussion. Helen Wanyama, yes, good afternoon to you. Danson Murimi, yes. Yes, I agree. Cheptonui Caroline, we can see you. Dennis Ilaya, we can see you. Jane Riari, hello. Vincent Kimani, yes, we can see you. Stacy Okech, yes, we can see you, Stacy. Dismas Muyuga, yes, we can see you. There's someone who was registered as Techno. Please write your official names because with the name of the phone, we cannot submit a list of attendance. Remember, we shall only issue certificates once one has paid, one has attended the meeting. We cannot issue on the phone's name. Kindly write your official names. Anjeru, yes, we can see you. John Ruto, we can see you. John Ochieng, Benson Malau, we can see you. We are going live at exactly 3 p.m. Friends, welcome to the Lab Medicine Society of Kenya. Welcome everyone. Welcome Sheila. Welcome Nancy Ekasi. Welcome everyone. We are going live at exactly 3 p.m. At exactly 3 p.m. So tell your colleagues, those who registered, tell your colleagues, those who registered, that they can access us through the meeting link, the Zoom meeting link and password that we have pinned on the wall. Kindly. So allow me to take this opportunity. It's 2:59 p.m. to welcome everyone to Lab Medicine Society of Kenya. Today, the 9th of May, 2025, to our webinar, which is Quality HVS Microscopy and Reporting. So allow me to make these announcements. First of all, I'll introduce myself, that I'm Frederick Obade. For purposes of this webinar, I will be your moderator. And this webinar will attract 3 CPD points that's accredited by KMLTTB. So immediately after this webinar, you shall start receiving your certificates of participation. And once you receive that certificate, you can go to the KMLTTB portal and upload the certificate. Then you shall be accredited with 3 CPD points. When you are doing your self-reporting, you may encounter a place where you are asked our physical location. Kindly log into our website, and that is www, as you can see projected there, .lmsk.co.ke. You shall be able to get our physical location. Now, we also have our WhatsApp group where we do our daily updates, and you are encouraged to join our WhatsApp group so that you are not left behind. In case you are not able to trace the link to the WhatsApp group, kindly reach out to the numbers that are projected on the screen right now. Now, our certificates will be processed effective immediately after the webinar, but we call for your patience because of the large numbers that we are attending to. The certificates may take up to 3 days. So if you don't find the certificate today or tomorrow and your colleagues are telling you they received, just be patient because it's work in progress. And then finally, allow me to invite our today's speaker, who is Cosmas Bachelor's degree or a Bachelor's of Science degree in Medical Laboratory Science. And he also has a Master's in Public Health. So allow me to take this opportunity, ladies and gentlemen, to welcome Cosmas to proceed with the presentation. Thank you very much. So there will be no questions or interruptions during the questions in the chat box in case you have any concern. At the tail end of the presentation, you shall be able to ask questions, make your contributions, and any other thing. Otherwise, welcome, Mr. Cosmas.
Okay, thank you so much, Mr. Frederick. Please confirm that you can hear me.
Yeah, you're loud and clear. Proceed.
Yes, we are able to hear you.
All right. Thank you so much also for having me and for this opportunity to interact with all of you. As you have heard, my name is Cosmas. I'm a medical laboratory officer, and my main area of practice is in quality assurance and quality management, a position which I'm currently holding in my current area of employment. So we shall dive into this presentation, and this one is informed by some study that was done a while ago, not in Kenya, but somewhere in the US. And the clinicians were asked how they find how relevant they find the information that has been provided as the results for their HVS exams, and whether those particular findings were in tandem with the intended clinical management, or they are helpful in the clinical management of the patients or not. And it's surprising that only when you have microscopy, it's very variable, and it actually depends on the people that are handling the microscopy and the competence of the people that are reporting. And they reported that the satisfaction level was as low as 20% to 70% as far as microscopy is concerned. So maybe they are targeting to see something, and maybe that thing is not captured, or it's captured in a way that's not very conclusive. And they prefer things such as culture and sensitivity, which of course we know that, of course, there are superior methods of detecting these particular pathogens in a HVS. So with that in mind, I think this is something that we can be able to internalize, and so that we, as we go forward, we can be able to provide information that's actually very relevant to the clinicians, very relevant to the patients that we are actually handling, so that when they get better, their UTIs are resolved, and courtesy to you at the back door of your labs. I think all the credit shall come back to you. So the topic today is on quality HVS microscopy and reporting. And if you are using your phones, you can maybe turn them to the landscape mode so that you can be able to view the slides very well. And those are my details. So we shall just go direct the objectives of this particular presentation today. And we're going to understand the common organisms that are detectable on HVS microscopy. And then we'll explain the indications for HVS microscopy when it's necessary. And then describe the collection procedure for the same. And then highlights the main quality areas of HVS wet preparation and gram staining, and expound on how you can be able to frame your report in a quality manner so that this report is specifically answering a particular question that the patient is having or the clinician is having, and it can be able to, be reproducible. If you've done it here and your colleague happens to do the same test, then there is a high likelihood that the sensitivity of that particular analysis will be the same. You'll get the same report at the end of the day. So on the common organisms that are detectable on a HVS, I think we all understand the anatomy and the anatomy of the vagina, which is, of course, something that we need to keep in mind as we look at this particular sample that you received, which is an HVS. And the body is made in such a way that there are so many areas of human normal flora that are colonizing almost entirely everywhere of the every part of the body, including the oral cavity, including the GIT, the skin, and also the vagina, which is another area where there is a lot of normal flora, bacteria that are actually very beneficial to the human body, to the ladies, as far as their reproductive health is concerned. But it only happens when there is a disruption of that particular normal flora that now you may find other organisms that are not indigenously supposed to be there, but somehow they have found their way into the vaginal canal, and it becomes a problem, which will now present as a UTI or any other symptoms that might be able to accompany the infection. So as we keep in mind, we shall be able to, we need to understand that the main normal flora, the bacteria that's colonizing the vaginal canal, is the lactobacilli. Several species, but the same genus, which is lactobacilli. These are very, very, very long rods that are gram positive, and on a HVS you might not be able to tell them apart if you're doing a wet prep only. But then there are others like Gardnerella and Mobilingus. Those ones you can be able to tell them apart. Also on a gram stain. So on a wet prep, you can be able to detect this bacteria. You'll just see motility of the bacteria around power 40, and this one you can be able to appreciate them on a wet prep. Further characterization will come with a gram stain, and then you can be able to report them as such. Because it's only after the gram staining that you can be able to tell that this is a pathogen if it is not gram positive and it's not very long and very ambiguous. The lactobacilli are very big. They're very ambiguous. You cannot mix them with any other normal flora or any other organism. And they're actually some of the few bacilli or rods that are actually gram positive. And then others like Candida albicans, those are fungi that we expect also to find in terms of HVS analysis or exam. This one is a Trichomonas vaginalis, which is another organism that you can be able to find. These ones are very motile, and they can easily be detected by their own motion, which should be differentiated by the Brownian motion of a wet prep maybe that has been swept away by a wind or something like that. But their movement is very, very characteristic, and you can be able to tell them apart, especially when the swab has been made freshly. Now, others that I've included here are like the pus cells. We understand the pus cells, the clue cells, which are very important as well, and then the epithelial cells, very many, because the vaginal wall keeps on shedding, due to frictions that are caused by several things. And then you can also expect to find red blood cells or spermatozoa on a HVS exam. These are wet preps for those ladies that have been maybe defiled, or those gender-based violence cases. If you are working in a GBV center, you can also use HVS as a way of providing more evidence to substantiate the defilement cases or the GBV cases that are actually brought to you. So you look at it very well, you can be able to identify the spermatozoa if it's a fresh case, the RBCs and everything like that. So those are some of the things that are actually detectable on HVSs, and they all have different presentations, different indications. And as you look at it, most of the time the clinicians will not be able to provide the clinical information for us, but we should be able to have all these things in mind so that the report is going to make sense to whoever that's going to see it. For example, if it's a GBV case, although we will be able to report the presence of other gram-negative organisms, which, of course, others may also include things such as E. coli, but that's now another pathogen that has been transferred from elsewhere to the vaginal canal, and it can only be told apart by doing culture and sensitivity. But so you need to understand that in particular instances, you are supposed to report in such a way. So if it's a GBV case and you're reporting bacteria, although you're helping the STI area, but you're not answering the main question, which is whether it's a defilement case or it is not. And if there is a symptomatic, strong symptomatic presentation of Candida, and of course you're not able to see it. Of course, some of those are rare cases where there are some people who can be able to have symptoms but with nothing on the HVS, but they are very rare cases. But I'm just trying to say that you can try as much as possible to marry or to relate the clinical presentation or the clinical history of the patient with what you are actually reporting as the final report. So the indications here for HVS are such as, these are reasons for why HVS can be done, like things such as vaginal discharges and low abdominal pain, things such as itching around the perineum, and anatomically you understand where that is. Irregular pervaginal spotting, it can also warrant HVS exam. Foul smelling discharge, and then cardi-wide discharge, especially for fungi, and GBV exams. Now, for those guys who are also doing some work in histology or cytology, or maybe they're reporting cytology cases, you can also you can also have an indication like maybe telling the time of, or maybe estimating the hormonal status of the lady that you're actually examining through staining this HVS with H&E stains, the ones that we actually have in histology. So there's particular areas of the normal monthly cycle that you expected to find a particular finding in the layers of the epithelium of the vagina, and they correlate with the hormonal status of the patient. So these are things that can be able to be detected, of course, during the monthly cycle. So any of those can be an indication, and you should be able to marry the indication with your findings so that your report will be able to make sense as the consultants and as the doctors and your colleagues also are going to be having a look at it out there, because you never know after you've released your report, you never know who's going to have a look at it. Now, as we go to the collection procedure, some people have these instructions written somewhere and hung in their phlebotomy rooms, where if you have forgotten a step, you can easily go through with a patient, and then you can be able to explain them, or they can be printed and kept in a file somewhere in the phlebotomy room, so that you can always ensure that you are doing the same thing every time. What is there is a lot of lack of standardization in most of the procedures that are happening, but how I wish that now that we've already trained on ISO 15189, that we standardize also the way of doing these things, so that if a patient comes today and they are told to collect HVS in this manner in the same lab, and then they come later on and they're told different things again, I think it's a weird picture that goes out there. And it's very good to protect your name, to protect your facility, and to protect also your practice, and you make it standardized, which is reproducible. Now, the procedure here will include, first the patient will need to wash their hands to ensure that they're not contaminating the swab, neither are they introducing some other bacteria into their vaginal canal. Then they should rinse and dry. The cap should be twisted to break the cap. You should twist the cap to break the seal. The patient should be able to do this on their own after they have gone to the washrooms. Then they should be able to pull the cap with the attached swab off the tube, and never to touch the tip. That's soft tip that's spongy. They should never touch it because they will be contaminating that one. And then they should never put it down as well after opening. So you only open when you are sure that it's going to the next place it's going, it's the vaginal canal. Then hold the swab by the cap with one hand so that the swab tip is pointing towards you. And with the other hand, you spread the skin outside the vagina. These are the labias. And then they insert the tip of the swab into the vaginal opening. And then this one, you point it towards your lower back and relax. That's the anatomical positioning of the vaginal canal. It's directly it directly points to the lower back, around the lumbar sacral area of your vertebral column. So the patient should be able to point it towards that direction so that it can experience very little resistance as it moves. Then gently slide the swab no more than 2 inches into the vagina, making sure that the swab touches the walls of the vagina so that the moisture is absorbed by the swab. This is actually the ordinary length of the relaxed vaginal wall, so that you're going up to the vaginal fornix, the area behind, just next to the cervix, and that area actually harbors a lot of bacteria. When you get that region, you'll have very good material for microscopy. Now you're supposed to rotate the swab for at least 10 to 15 seconds, allowing maximum absorption. Then withdraw the swab without touching the skin. That's the skin, the labias, and then place the swab in the tube and secure the cap. Secure the cap. You should repeat those steps if another swab is required. Maybe you need one for microscopy and another one for culture. You can have them both collected at the same time, and the same procedure should be followed. Then after the collection, hands are supposed to be washed, rinsed, and of course, dried for safety purposes, and then they're supposed to be returned to the lab now for analysis. So after we have done this, that's the same procedure that I've actually highlighted in terms of pictorial representation. Those are the 5 main steps. And as you can see at step number 3, that one is actually pointing directly to the lower back. at the lumbosacral area, just above the gluteal muscles up there, upper corner, upper juu. So you can be able to see where the swab is pointing, and that's exactly the position that the lady is supposed to maintain as they do the swabbing. Then just next to the cervix, I wish I had a way of pointing it, but you can see the uterus, the cervix pointing upwards. So just behind there, the fornix is behind there. That's where the swab is supposed to get, and then collect a lot of materials from there. Then withdraw, seal the cup, put it in the container, seal the cup, and then deliver it to the lab for analysis. This is supposed to be done very fast, especially if you're targeting organisms such as T. vaginalis, which are motile, and motility will help you to identify them, because once they have stayed for a while, they'll mimic some things like epithelial cells. You'll just see something like an epithelial cell, but it's an actual T. vaginalis which has been immobilized, maybe because of a dry swab or overstaying, like that. So we go to the wet preps, and there are two, but I think one is the one that's commonly done. We have the saline preparation, which is the wet prep, and a small amount of the sample is actually placed on in normal saline on a slide, and a drop of saline is mixed with the discharge, and then or that's another way. You can either put a small sample of the sample of a small sample of the material that on a saline that's already placed on a slide, then of course make a smear, and then, or you can mix the saline with the discharge and then drop one or put one drop on the microscopic slide and then examine. You examine a power 10 and then power 40, like that. Power 10 will be able to give you a very good picture of the entire, large area of the smear, so that you can be able now to help you pinpoint where the organisms could be found. Because if it's something like T. vaginalis, you will see motility. You will see motility all over the place. And then now at power 40, you can now focus in that area and then confirm your diagnosis, like that. Then you should look for motility, as I've also highlighted. Blue cells can be also seen on a wet prep. If you're very good, you'll be able to see glue cells, which are epithelial cells that are heavily colonized or heavily infested by bacteria, and they'll be seen like small dots all over the epithelial cell. I'm sure when we're talking about an epithelial cell, we understand. So there are a lot of bacteria that can be able to colonize the epithelial cell, forming the glue cells, which are very, very important in the diagnosis of bacterial vaginosis, which we shall be able to look at later on. You should be able to also identify the blood vessel, the white blood cells, pardon for that, which are pus cells, and delineate them, of course, from RBCs if they are there, and then make a conclusive comment. So you describe what you have seen on a wet prep. If you have seen anything like a fungi, you report. You've seen a bacteria, you report. Or bacteria, you report. You have seen T. vaginalis, you report. If they are present or they are not, you should also just indicate that. Because if you don't indicate it, then the clinicians or the person looking at your report may assume that you actually never look for this particular detail in your slide. So if it is you're reporting on fungi, you should report that no fungal elements have been seen or noted. Bacteria, you should be able to report whether you have seen them or not. Epithelial cells, you should also be able to report that you have seen them. Because if you've not seen the epithelial cells, then that means that a substandard swab was done. That means that the swab was not done on the vaginal walls. Maybe it was just within the cavity, and it's not very, very representative. So you see the epithelial cells, it's a clue that your sample has been collected the right way. And then report also on that. You see the clue cells, report them. They're very important in bacterial vaginosis. Now, for those guys who are querying maybe fungi, and on your wet prep, you can be able to see the budding yeasts. But then you need maybe further characterization. If you do a KOH preparation of the same wet prep, you can see the hyphae of the fungi. And this can be able to help you diagnose fungi, presence of fungi, and especially in this case is candidiasis. Now, following this, maybe fungal culture can be done to confirm your diagnosis. And then also there's something called a Whiff's test. This one is for bacterial vaginosis, where a drop of KOH, 10% KOH, is placed on is mixed with a sample. Then there is a fishy odor that will be able to, you'll smell it. This one is indicative of bacterial vaginosis. So don't know, those ones are very, very non-specific tests, but they're there. There are some people, I think, they are doing them, but they're very non-specific. That's why there is a way, as we shall be able to see later on in the presentation, there's a way we can be able to tell better on how we can be able to report these things. But I just wanted to highlight them so that we can appreciate that these are things that are available out there, and guys are doing them. So further to that, the prepared slides now, this is on microscopy. I examined under low power, this is power 10, and then high power magnification to identify any signs of infection. And then interpretation of the wet prep should be like, if you have seen T. vaginalis, you've not seen them. You say that none has been seen. No T. vaginalis seen, no clue cells seen, no hyphae or budding yeast seen, like that. No pus cells seen, if there is something like that, so that someone can be able to know that you have looked at these things. Yeah, and it's supposed to be a standard way of reporting, actually, so that if someone else is doing it, just like maybe a reporting template or something like that, so that you may not miss a detail. And the person reading your report will now have it in their mind that you have actually done your work. You have looked at all the entire things that could be looked at on a smear. So reports, if they are there, T. vaginalis, they are motile, pear-shaped protozoa that actually indicate trichomoniasis. Blue cells, as I had mentioned, they are vaginal epithelial cells covered with bacteria. They suggest bacterial vaginosis. When they are present, the score goes very high, and it will be able to support bacterial vaginosis. Now, we'll also be able to look at the yeasts, hyphae or pseudohyphae in the case of candidiasis. When you have actually done the KOH preparation, you can be able to see them, or sometimes the H&E, you can be able to see it, or even the Papa Nicolo stain. The guys in cytology can be able to appreciate that. They can be able to see the body. They can be able to see the hyphae in that particular smear. Then high number of WBCs, which will be able to suggest a vaginal infection, as I had mentioned on Whiff's test, which is rarely done. Now, the other one is gram stain. Gram stain is now one of the major things now, because HVS will be, subjective, very, very subjective. HVS wet prep is very subjective to the person. It depends on the person who is examining the slide. So if you're subjective, I mean that it's not very, you can only, the only person that can be able to determine how good the report is the person who is actually reporting the slide. And that means that we need to be very good at doing this to avoid that subjectivity, because it's very subjective, and with the varied sensitivity and the ability to detect the presence of those organisms or abnormalities. And we need to be, that's why these trainings are there, to ensure that we are up to date, and we can be able to report these things the right way and the same way. When you are reporting it and another person from the same department does the same reporting, you guys are going to find the same results, and you'll go home a happy team in the evening, right? Because you have sorted someone's problem, and you have helped them go get the right treatment. Now, on gram staining, we all know the procedure for gram stain. And the target organisms, these are either delineate between the gram positives and the gram negatives. And those gram positives are usually mostly the commensals or the normal flora, and the non the other bacteria. I'll use the term other bacteria apart from being gram positive to mean the others that might be pathogenic. So the procedure is, you have to first prepare the slide, the smear, and heat fix, right? Then air dry. Of course, after air drying, you heat fix, and that to adhere the bacteria so that you can withstand the washing steps. And then apply the primary stain for 1 minute so that it can penetrate the wall. And then you apply the mordant, which is grams iodine. This one will bind with the crystal violet to form a very complex a very complex stain for the gram positives, and it will be very, very difficult to remove it in those organisms that are gram positive. And then you decolorize with an acetone. I prefer acetone than other alcohols. I prefer acetone; it works very well immediately. And then you can now go ahead and then do the counter staining with safranin or any other counter stain that you're having in your setup. Then do the microscopy. Do the microscopy. And this part is now where we need to dwell in. I think I've done much on the wet preparation, but on the gram stain, I think it's very important that we need to understand that there are gram positive organisms that are mostly non-pathogenic. And then there are gram negative organisms that are, could be pathogens. And then these ones are correlated. Now, because of the normal flora of the vaginal wall, we can only tell whether a person is having bacterial vaginosis or they're having it's called bacterial vaginosis, when there is reduction in the normal flora and then elevation of the other bacteria that are not normal flora. It's an imbalance in the normal flora, and it leads to bacterial vaginosis, as I've explained. So we need to report in such a way that after doing the gram stain, you shall not just report that gram negative organisms have been seen, or maybe gram positive and gram negative organisms have been seen, because that one will not be very, very helpful to the clinician, because or to the patient, because you're expecting to see some gram negative organisms, but how much of them are there? And then also you can be able to expect to see gram positive organisms, but now how much of them are there? That is where the quality lies, and you need to be in a position to quantify these organisms and score them. And these are standard ways of doing this, which are have been studied, and they are very reproducible, which means that if a different person is doing the same thing, they can easily find the same number of organisms that you found and report the same thing. So that's why we are not gonna concentrate on reporting things just as gram positive organisms seen or gram negative organisms seen, but we're going to grade them using what we call the Nugent score. And in this slide, you can be able to tell that the Nugent score can either be consistent with the normal vaginal flora. It can be intermediate, whether you cannot tell cannot tell whether this is a normal flora or bacterial vaginosis, or it can also, and it can also be consistent with bacterial vaginosis, depending on the number. So this is what we're going to discuss in detail in this particular slide. That's a summary of gram staining. I'm not going to belabor on that, but I want to look at the Nugent score. So this is going to help you now that you can be able to tell the fungi, you can be able to tell that they're present or they're not. Their numbers doesn't matter. Their presence matters. You can be able to tell the presence and the absence of T. vaginalis. The numbers doesn't matter. Or maybe it may matter with the clinical presentation of the patient, but for you have identified. That's very important. But for bacteria, you're supposed to quantify them in a way and give it a score. And there's a guy called Nugent who devised this score in 1991, and it's been in use. And it helps classify those things into the tree that have actually highlighted there. So the first score is between 0 to 3. We're going to look at how you can be able to get these scores, which is suggestive, which suggests a normal, healthy, balanced, vaginal microbiota or flora, which is predominantly lactobacilli or lactobacillus. 4 to 6 is intermediate, which indicates a shift, slight shift in the flora, but there is, of course, with the decreased lactobacilli, and then the increased quantities of other bacteria. Excuse me. So you can be able to see that, on this particular gram stain, the gram positives are very few. Yeah, they are actually not more than 5 on this particular slide. You can give it a score on that particular, and you can count and see that this bacteria, the lactobacilli, are more than 30. That one is a very good, HVS, and it's a normal flora. And the more lactobacilli you see, the less other types you see, because lactobacilli in itself, and from your immunology, you understand that normal flora are part of the innate immune system. They help fight against other pathogenic bacteria. So the more lactobacilli we find, the less other types we find. The more the other types we find, the less the lactobacilli we find on that particular slide. And it will be able to help us arrive at a conclusion. Now, from 7 to 10, that's bacterial vaginosis, a HVS that's consistent with bacterial vaginosis. And this range signifies a significant imbalance in the vaginal normoflora that's characterized by lack of lactobacilli, and the presence of Gardnerella vaginalis. These are gram-variable organisms. And others like mobilincas. Mobilincas are curved. You'll be able to see that there are some curved morphotypes of organisms. But the gram staining is just on the morphotype. You can't exactly tell that this is a particular organism by looking at it on a gram stain, unless you have done some other biochemicals and identified the actual species of the organism. But the morphotype is consistent with some organisms that already know. So you'll be able to tell that this is the lactobacilli morphotype, or these are organisms that are actually looking like lactobacilli, which are gram positive. And then Gardnerella are gram variable, and these are organisms that are actually having this morphotype in this particular slide. You can be able to count them. And others that are curved, which are mobilincas morphotype. So you can be able to count all these three on the same field and estimate the numbers. So if you get that the lactobacilli are above 30, very good. There's a score for that. If you get that the Gardnerella are between 1 to 5, very good. There's another score for that. If you get that there are no mobilincas, it's 0. Then another score for that. And then you can be able to add what you've gotten for lactobacilli, you add what you've gotten for Gardnerella, and you add what you've gotten for mobilincas, and then you get your Nugent score. Now the total that will be able to now culminate into either normal flora, if you found down something that's less than 3, something that if it is 5, it's intermediate, you can't tell, but the clinicians will be able to understand that because it's just an imbalance. And then if it's above 7 to 10, that's consistent with bacterial vaginosis. And something like maybe culture should be done to further characterize this bacteria and do a sensitivity test for the respective antibiotics that are going to be able to work in this particular case. So, apart from the Nugent score, there's an arm cell criteria, which I just wanted to mention briefly. A very good one. It's not reproducible, but it bases on the vaginal pH. If the higher the pH, the poor the higher the infection level, if I can be able to put it like that. Because the normal pH of the vagina is less than 4. It's just less than 4.5 acidic, which is very, very harsh for other bacteria to survive. Then you see clue cells on saline preparation in the arm cell criteria. Release of amines by addition of KOH to a drop, which is the WIF's test that we actually looked at. Then a characteristic thin homogeneous vaginal discharge. So if these are present on the arm cell criteria, you will conclude that this is a bacterial vaginosis, but somehow we can't measure the pH. It's not very easy. The vaginal pH. So that's why this one is not very, very good. It has very poor sensitivity, specificity, which makes the Nugent score to be preferred. And this is what we're going to concentrate on by looking at this table here. I need us to take some time and look at it. So you'll be able to look at the score. You look at the first column there is the second column is the lactobacilli morphotype per field, and then the Gardnerella morphotype per field. This field here is the oil immersion field because there is no way you can be able to see a gram stain in another field. So and then this is per 100. Then there's the Gardnerella morphotype. There is the curved bacteria, which are the Mobilincus morphotype. Now you're going to count these ones per field. If you are finding that their field is everything, everywhere, you just pop in there and you see everywhere these are gram positives. There are more than 30, then the score is 0. And when there are more than 30, and you'll not be able to expect to find other, types of bacteria because this nomoflora is helpful. It's protecting the vagina against these others. So the other scores will be 0. But if you find that you are reporting that this one is above 30 and you're finding also you're seeing Gardnerella, there must be something wrong with your gram staining. Now the quality of gram stain comes in and it will be able to help so much here. By the way, if you need to know that your gram stain has been able to stain the right way, you'll be able to look at the epithelial cells, which are supposed to be gram negative because they don't have a cell wall. They'll pick the counter stain. So they're supposed to be gram negative, pinkish red. If they're appearing bluish, your decolorization is not very good. So you're going to have trouble distinguishing these particular organisms, and you'll have trouble reporting an Nugent score. But if you have stained the right way, you can be able to count these organisms as we have been able to indicate there. So if you have found your lactobacilli above 30, this is a score of 0, and 0 to 3 is, of course, that's a normal flora. If you find that the lactobacilli are between 5 to 30, the Nugent score is 1, and then you count the Gardnerella, they're less than 1 per field. You look at the field, you're only seeing maybe 1. Some fields you don't see any, yeah. You will also be able to give it a 1, and then the curved ones, you will be able to see 1 to 5. You also give it a 1. So this is 1 now plus 1 plus 1. It is 3, which is also consistent with the normal flora. The problems now will be able to start from maybe, if you're seeing very, very little lactobacilli, maybe 1 to 4. These are greatly reduced. And then you look at the Gardnerella morphotype, you're also seeing 1 to 4. And then the Mobilincus, you're seeing above 5. This one is 2 plus 2 plus 2 plus 2, which is going to be 6. And that one still is inconsistent, intermediate there. This is not a bacterial vaginosis, this is not a normal vaginal flora, but something must click in the clinician's head that this is something that is maybe it's a developing pathogenesis, it's a bacterial vaginosis in process, which might now warrant another HVS to be done maybe later on or covered on antibiotics altogether. And then on number 3, score number 3, if you're seeing lactobacilli that are less than 1, give it a score of 3 there. You're seeing Gardnerella that now 5 to 30, very many. You also give them a score of 3. You are seeing the curved ones that are 5 to 30, also very many. You also give it 3. So you'll have 3 plus 3 plus 3, which is 9. That is going to be consistent with bacterial vaginosis because it's between 7 to 10. Then if you're not seeing any lactobacilli, that's already a red flag. In fact, that's already a bacterial vaginosis because the rest now will be many. And as you can see, the more the lactobacilli, the less the other types, and vice versa like that. And on that level 4, that part 4 there, you'll most likely also to find the clue cells there, because the clue cells will only be present if there are other types of bacteria present. Lactobacilli are not do not somehow attach to the epithelial cells, so they will not be counted. They will not be like clue cells. I think the other types of bacteria are the ones which are going to be stuck on those particular epithelial cells. And when you're having that particular score down there, most probably you're going to see clue cells in your exams. Alternatively, you can use the other lower end, which disregards the bacterial, the curved counts above 5. You can see that the scale on the lower side is the same, yes, but the only difference here is now that the mobilincas above 5 are regarded as a score of 2. Anything above that is a score of 2, because it's very rare to actually find mobilincas. The most common morphotype is Gardnerella on your HVSs. So with this particular thing, you're not going to report this is a gram positive. Maybe your final report is not going to read maybe gram positives seen. You see now the reason why I was saying that. Your final report is going to say maybe gram negatives seen, is going to be a score, an agent score of 7. The interpretation consistent with bacterial vaginosis. HVS, gram stain, an agent score of 0, consistent with the normal vaginal flora. So that's the particular report that's going to go out there. And this is going to be very, very helpful to the people that are going to be interpreting your report. They're not going to be confused, because if you've seen maybe some few gram negatives, you've seen some few gram positives, then what are they going to do with that report? So if you're provided such kind of information, it becomes very, very easy for the clinicians to do their work and actually help the patients like that. I just want to show us the appearance of clue cells. You see those ones over there. And of course, that's the interpretation of the vaginal gram staining. Normal epithelial cells are going to have very few bacteria, if any, but clue cells are highly colonized. You can see that a lot of bacteria are stuck close to them. If they are seen, those ones are going to be reported, and they are. When you see a clue cell, that's already a 4. It's already a 4. On a wet prep, that's the way they will be able to appear. Just small dots, because this is not, you see, this is power 100 here. If I just go to the previous slide, this is at power 100, where you can be able, this is a gram stain, for example. And that's the size of bacteria at power 100. So at power 40, you'll expect them to be very small, because if they are that long at power 100, then at power 40, they'll be this short. They'll be just like like dots, but they're within the epithelial cell. You can see the nucleus, you can see the cell membrane, you can see the cytoplasm, but within the cytoplasm, there are a lot of bacteria that are colonizing there. So this is what a clue cell appears, and you can be able to report their presence or their absence in a particular gram stain, like that. So as we finish this particular presentation, we're going to look at the importance of quality HVS exams, as we've highlighted and seen. We can be able to say that quality HVS exams and reporting will be able to help in early diagnosis and treatment of infections, because you'll be able to identify them at the first time a patient is coming to you. You're not going to miss them or misreport and lead to unnecessary delays because of further investigation. And then they are going to lead to identifying the cause of a particular infection in tandem with other investigations, of course. They're going to guide for further testing, such as cultures. Also, they're going to help in the collection of evidence for GBV victims. So those are some of the importance of course, just that I've highlighted for us. We're doing the practice in clinical pathology or general medical laboratory sciences. But there are others more which are also important. The importance of HVS for guys who are in cytology and that kind of practice, because they can be able to see other abnormalities on an epithelial cell that is shed in the vagina, just as we've been able to identify before. So that was it for this particular presentation. And maybe, I don't know what the time is. I think I'm just 9 minutes into the time that I was given, but we can have an extensive time for questions or maybe an interactive session. Maybe if I can be able to take it back to Frederick as you look at the references that I used for this particular presentation. So Frederick, back to you. Thank you.
Very well, Mr. Cosmas. We are very glad for the presentation. It was very informative and very organized. And at this point, I want to invite questions. If you feel you have a question or you want to comment or you want to put your thoughts on the topic that you've just had a webinar on, this is your time. So you can raise your hand if you want to speak, but I'm going to read in the text or in the chat box any questions that may be there. So if you want to say something, please just type in the chat box so that you're able to read loud and proceed. So I want us to keep the chat box very objective, so that we don't have your names and things like that. Our system already automatically captures your name once you join, so no need of typing your name again. Now I want to just get a comment. There are questions from this is wow, the comments are coming quite fast, but allow me to read the following questions.
There are some questions in the Q&A. I think we can
yeah,
access.
sure. Yeah, let me go there.
Please. All right.
So the first question is, who is supposed to collect HVS samples, patients on healthcare providers? And then, okay. George, can you just proceed with the QA session? I just attend to something. George.
Maybe as George prepares, I can be able to answer that.
Okay.
For those guys who are, working and you're just gentlemen, it's advisable that you let the patient collect the specimen themselves. But you have some ladies around, they can help in the sample collection. For the purposes of medical legal issues and avoiding your name, we've seen cases where patients have turned on some medical, although some cases are genuine, But just for you to be safe as a gentleman, please allow the lady to collect the sample themselves, as you've explained, or if you have a lady friend or a lady colleague, let them collect the sample for you. They can be able to do it the right way, of course, using the speculum.
Thank you. Then we have Adendo Opondo, who asks, what are the clue cells and how do they appear microscopically? Thank you, Opondo, for the question.
Clue cells are epithelial cells. We know that the epithelial cells are, normal shadings of the vaginal wall that can be seen on a high vaginal swab. These cells usually have bacteria colonizing them, sort of. If this plant is having a condition that we're calling bacterial vaginosis, there are bacteria that are actually going to colonize these particular epithelial cells, which are going to turn them. They're just epithelial cells, yes. But now, because of the high colonization of the abnormal bacteria, they are now called clue cells because they're going to help us provide more clues, yeah, into the diagnosis of bacterial vaginosis. So they are epithelial cells, but they're heavily colonized with other bacteria that are not actually lactobacilli.
Thank you. And then someone is asking, how reliable is the self collection of HVS, and is it the gold standard? And then the second question goes, in the event I am sending a patient for both urine and HVS samples, which one should they collect first?
Okay, I don't think there's a gold standard way of collecting a sample. The only thing that matters is the quality and the following the procedures, because even the healthcare providers can collect very weird samples. And depending on the instructions that you actually are following when you are doing the sample collection for the patient, that will determine the quality of the sample that you're getting. And if you have explained to the patient the right way of collecting the sample, you'll get the same quality of the sample, just as the same as what another healthcare provider has done. So it's a matter of following the standard way of doing things. And then the sequence of collecting samples, urine itself has other bacteria that are not indigenously, of course, what is it called? Initially in the vagina, because these are now the urinary tract infections. So I think you'll be able to first have the urine sample collected, then clear clean your hands, of course, and then open your labia, because the urine doesn't go into the vagina. It is just at the perineum there, because that's where the urethra exits. So clean and collect your urine sample, also to avoid the discomfort, because if a bladder is full and you're inserting things into the vaginal canal, again it will interfere with the reflexes of the control of the muscles of the bladder. And so you empty your urine, collect it, and then now you can be able to aseptically also collect the vaginal swab inside the vagina by opening the labias. So you can do that cycle, and I think that is going to be to avoid gross contamination. Yes, back to you, Frederick.
There are more questions. Someone is asking, Millicent Odero, is it possible to report both clue cells and bacteria at the same time? And then let me put in another one. Mary Mwangi, is it advisable to put saline inside the HVS swab, shake a little, then place a drop on a slide while doing microscopy instead of placing on the slide?
Yeah, those are the two methods that I've actually described in this particular presentation. You can either put a drop of saline on a slide and then introduce the sample there, mix very well, and then leave the material there. Or you can introduce a drop of the saline inside there, the container, and then make your swab, and then introduce the material on the slide and then examine. I think the other question was the epithelial cells. These ones and the clue cells, you can only report those ones on a wet press. on a wet prep. But with the gram stain, just report the Nugent score.
That's clear. Geoffrey is giving a comment, and I think he's saying that, Geoffrey, you're saying kindly compare the quality of HVS sample collected by the patients themselves to the ones collected by the lab tech or the doctor. I suggest that the sample should be collected by the lab officers or the doctors. And then maybe another one, when do you make gram stain? Direct from the swab or after adding some normal saline to swab to make small solution?
Pardon that question?
When do we make gram stain? Direct from swab or after adding some normal saline to swab to make some small solution?
Yeah, it depends on how dry your swab is, because if the swab has been collected very well, then it will have absorbed the moisture from the vaginal wall, and it will be able to allow you to make a very good slide. But if the swab is dry, there is no way you can be able to transfer the material to the slide, and that means that you will need to introduce a normal saline drop on the sponge end of the swab, and then now make your smear. But if it's been collected well, you don't need that because it will be wet already.
Thank you for that's clear. Adendo Opondo is saying, in HVS collection, why are we not using a speculum? I know the procedure given here is self-collection, but is it not prone to contamination with a lot of commensals around the labia?
Yeah, it's prone to contamination if this patient has not been explained what to do. If they let the vaginal labias maybe collapse onto the swab before they take it out of the vaginal canal, but they're advised to hold the labias apart, yeah, so that they are not going to introduce any other contaminants on this particular swab. So advise the patients to hold the labias apart and have their samples collected. Or if you can be able to collect it yourself, you can be able to do the same using the speculum. You'll only access the vaginal wall, vaginal canal using the speculum. Some others can be accessed without, but it depends on which person you're handling.
Thank you. Alex Barasa Wafula is asking, what is the legal age for consent when collecting HVS? And what should be avoided during this procedure to avoid the medical legal issues that may arise?
Once the test has been requested, this one is supposed to sort of act like we don't need a written consent for that, but you need to engage the patient on the procedure itself. And to avoid the medical legal issues, which we have seen in this country, Kenya, and that's why I was saying that if you have lady colleagues, let them collect the samples for you. As a gentleman, please do not. Or you can collect the sample in the presence of another lady in the room so that you can avoid these medical legal issues. There are many things in Kenya and anything can happen for you. So for you to be safe, to be on the right side of the law, let the patient collect the samples themselves. And if you must collect, let another person be there. It can either be another healthcare provider, not their second of kin or something, because clients can come with their own motives and they can gang up to sue you, and there's nothing to be able to do about that. So let your colleague be there, not their own other kins or someone who has come with them to the hospital. I think that is it.
Ata, proceed with the other questions.
Thank you, Fred. Another question from Iano to everyone. In the case of GBV, do we do wet prep or gram staining?
Pardon?
In the case of gender-based violence, do we do gram stain or wet prep?
Wet prep. Wet prep is the best for that. If you're doing your wet prep microscopy very well, it will answer the GBV question.
Yes, another question. Is it important to report microscopy of the HVS? Is it important? Yes, yes.
I don't know whether that question is very specific, because
Yeah, it's not specific.
it's not specific, yeah.
Yeah.
Yeah, so I think the whole topic has been on quality reporting, and you can report the microscopy, but the way you report it is what we've been able to discuss in this question, in this webinar, that there is some criteria that you need to follow. So maybe someone will be able to read through these slides and they can get the answer.
Yes. Are you able to do HVS on a patient who is on her menses?
No.
Are you able to do
Unless
HVS on a
otherwise,
pregnant?
I clearly know.
Are you able to do HVS on a pregnant woman or a pregnant mother?
Yes.
Are you able to do macroscopy and microscopy at the same time?
Yes.
Yeah. More questions are coming. Yeah, we've gotten pregnant clients. Yes. Are you able to accept an HVS sample collected by a patient, or what are the standard practice?
That patient must have received the instructions from you first before they bring in the sample. If they have not received the instructions from you, you can't trust that sample in the way it's been collected. So if you have issued the instructions to the patient to go and collect the sample, they can be able to bring the sample to you. If you have not, then it's important that you do the sample collection guidance to the patient, explain to the procedure very well to avoid those contaminations.
Is culturing important for HVS?
Yes, culturing is very important for HVS.
Now, a question from Silva Scoyo. In the reporting using the Nugent score, is it still necessary to indicate the gram staining characteristics, whether gram positive or negative?
No, just the final score is enough for you.
Okay, thank you. In case of HVS for culture and sensitivity, when is it the right time to do gram stain, before culture or after the culture?
2 gram stains are done. For me, I do the first gram stain. Culturing, you have to have two swabs if you need to do gram stain and culture, and another gram stain depending on the outcome of the culture. All right. So if you need to have your gram stain done before you do the culture, you need to collect 2 swabs, one for gram stain and another one for culture, because there is no way you can be able to do the gram stain and then you head to culture, because already that's a contaminated swab. So if you need to do a gram stain, collect 2, one for microscopy and another one for culture. If that's not very necessary, but in rare cases, so yeah, that's what I'm trying to say. You do your 2 samples, one for microscope and another one for culture. But you cannot do gram stain on the same swab and then head to culture. Or another way is maybe you can be able to incubate culture, your HVS, and then come back now and do the primary sample gram staining. But gram stain should not come before you do the culture because of the contamination.
Thank you. A question from Samuel Ondieki. How do you report macroscopy in HVS? Macroscopy.
Macroscopy, you report the color, you report the appearance, and any other thing that you may see. But the color and the appearance are very important.
Thank you. Another question here. In case of an STI, urinalysis and HVS, which one is most recommended in case of an STI?
These are subjective. Because you can't really tell. Both of them are good. For me, I can be able to say both of them are good, but it will also depend on the timing of your urinalysis. It can be more sensitive for an STI. You see, there are STIs, which are sexually transmitted infections, and there are UTIs, which are urinary tract infections. So if you are targeting a UTI, collect your urine, right? You're targeting an STI, collect your HVS, because there are different canals, there are different systems anatomically. So it depends on what you're targeting. If it's an STI, do your urine. A UTI, are you an STI? Both of them, okay. Urine can also show you an STI, but for STIs, the most sensitive one is HVS. So it depends on what you're actually having with the patient. Yeah.
Thank you. A question from Alex Mulele. Is it prudent to add a comment on an HVS sample collected by a patient? As, for example, sample collected by a patient.
If you have given this patient your instructions, you should not be able to give that comment. Maybe if this patient came with this sample and you don't know who gave them the instruction to collect the sample, you can give that comment. But if you have given this patient your instructions, why should you give that comment? There is no need to give that comment because you rely on how well you explain the procedure and you trust that you did the right thing, and it's not necessary to report it.
Thank you. What is the diagnostic importance of clue cells by Nyang'ao Nyamweya?
Clue cells most probably indicate the presence of bacterial vaginosis.
Thank you. Are clinicians conversant with the Nugent score?
They are conversant with the interpretation of the score.
Thank you. Do
So
the
that
pH
if
level of
to one, I don't know whether that makes sense. By the way, the interpretation of the score.
Yes.
Yeah, so they are not conversant with the way the score itself is. We are supposed to be conversant with that, but they are conversant with the interpretation that you give after that score.
Another question: does the pH, the vaginal pH, interfere with the interpretation of the HVS results?
It doesn't interfere. It interferes with it changes with the changing microbiota. So the pH will be different with different colonizations of the bacteria, but I don't think it can influence. It cannot influence the findings, the microscopic findings. It is the bacteria that are going to influence the pH, not the other way around. The change in bacterial, colonization. If there are reduction or in the normal flora, the pH will go up, and that will be the change in the microbiota that you can be able to tell on a gram stain using the Nugent score.
Yeah, there's another question on the quantity of normal epithelial cells in a wet preparation.
I don't think there is a standard way, a standard quantity, but the more the better. The more the better.
There's a concern from a lady that we got TV during the menses. So during the HVS examination, how will you interpret that kind of scenario?
You got your T vaginalis during a menses.
Yes.
Okay, because having a lot of blood in this particular swab is going to interfere with a lot of other things as well. Microscopy. So it's first of all not advisable to use that sample for your exam, and you should wait for this patient, to get out of the menses, and then you can collect a quality sample for your analysis. I don't think I can be able to comment on that. Maybe we just have to do what is supposed to be the right thing, and then do get the right results. Help these patients if they need to be helped.
Yes. We're waiting for more questions. Some questions have been passed because the questions are coming in real time. So we're waiting. So we want to differentiate between Nugent score and the glue cells. Maybe in brief, some of us have not gotten it well.
the Nugent score will, if clue cells are present, they are present when the Nugent score is above, mostly above 7, or if it is 5, the presence of clue cells will make the clinician will make you favor the bacterial vaginosis. So the Nugent score will go higher with the more likelihood of finding the clue cells. Both of them are important, but the higher the Nugent score, the more the probability of finding the clue cells in your sample or in your gram stain. So that's how they interact with each other.
Thank you. What are the precautions or the cautions to be taken when staining the HVS slides?
You just have to follow the right gram stain procedure, because if you over decolorize, you'll mess with the results. If you under decolorize, you'll mess with the results. If you under stain with the crisp violet with less than 1 minute or maybe 30 seconds or 20 seconds, you'll mess with the results. If you overstain with the crisp violet, like if you stick on the procedure of gram stain as it is, you'll have a very easy time doing your Nugent score. If you mess with the gram staining procedure, then you'll not be able to do anything on the Nugent score, and your results will be as good as, I don't know, they're not going to be very good. So do your quality, follow the right steps in gram staining, look at the quality of your gram stain. If it is fulfilling the quality criteria that has been established, you can Google it up. You look at the epithelial cells, how they are staining. If they are blue, you have a problem there, because they're supposed to be pinkish red. They're supposed to pick the color of the counter stain. So if you're looking at the gram stain and the first thing you're seeing is a blue epithelial cell, for me, I'll not be able to go ahead with that particular exam, because there is nothing that you're going to be able to see there. But you've stained it the right way, the slide will just guide you, and you'll be able to derive a very good Nugent score, and you'll get your diagnosis.
Yeah, thank you. How do we differentiate lactobacillus from Gardnerella and from Morbicollis?
Lactobacilli are gram-positive rods, very big ones, very big rods. They are blue. You look at the slide, you look at them, and they are blue rods. So those are lactobacilli. Gardnerella are gram-variable. They could be having some sorts of bluish, but they have a tail that's red, so they are gram-variable. They could be having some, a slight bluishness, but they are also gram-negative. That's gram variability. And they're very different from the lactobacilli, which are entirely blue. And they're also different from the mobilincas, which are curved. They look like comas, small comas. You look at the slide, and then you're seeing small comas of gram-negative organisms. Those are the mobilincas morphotype. And then you can be able to tell them apart, count them, and then give the Nugent score for the individual bacteria.
Zachary Muturi, how do you quantify samples for HVS analysis in terms of acceptance or rejection in order to have a reliable results after the analysis?
Your acceptance criteria should also maybe be in tandem with the steps that you have highlighted to be followed during the sample collection. But obviously, a sample that's grossly contaminated or stained with blood, you receive a swab and it's completely blood stained. Unless you're near GBV, you're not going to have a very good result from there. But if it's a GBV sample, go ahead, do the microscopy, and then report that one, because it's very relevant in that particular case. So you can reject if it's for the normal UTI or STI screening, but you can accept for the GBV cases. If you're receiving a swab that is grossly contaminated, it's just dirty, it's been collected from home or somewhere else, and it's been brought to you for analysis, you can grossly reject that one. Or scanty material, you receive a swab and it has nothing for you to obtain, you can categorically reject that one and have the patient collect another sample again. So those are just some of the rejection criteria that you can use.
Yeah, maybe the last question. Somebody is requesting that you repeat the last part of gram staining report.
Which is on the Nugent score.
Yes.
What? Maybe you can go to that particular slide, and I need guys to have a look at this. If you have your phone, please look at this slide very well, because this is the summary of the entire gram staining. So I was saying that if you should know that the lactobacilli are the normal flora, right? And they are gram positive. That's what you should know. Before you start looking at the slide, you should know that the Gardnerella are gram variable. They could be having some, but they're smaller than the lactobacilli. They're smaller in size. So you can be able to tell them apart from the lactobacilli, which are gram positive. You should know that the Gardnerella are actually curved. They are comma shaped. The mobilincas, they are comma shaped. And they're actually very few. So if you're counting, if you're looking at your slide like this, a per 100, just like the way you can be able to tell that these are an RBC, these are white blood cell, and these are platelet on this PBF, you can also be able to tell these three apart. You can count the RBCs that you can be able to see under the field, just the way you can be able to count the lactobacilli. Maybe if I can be able to use that one as an example. Then assuming that these Gardnerella are the white blood cells, you can also count them that are under the microscope over there. Count them, you put it aside. The curved ones are now the platelets. You can also be able to count them. So if you're counting your red blood cells, which is that these are lactobacilli, and above that, the score there is 0 because these are normal floras. And the lower the score, the better, because that's a normal vaginal flora. So you give it a 0. And most of the time, you'll not see any other bacteria if you're seeing entirely gram-positive bacilli. So these ones, you'll not be able to see them. That's why the score is 0, 0. And that one will be 0. And if you are seeing lactobacilli between 5 to 30, that's a score of 1, right, somewhere. And if you are seeing that these gram variables are less than 1, or maybe 1, some fields don't have any, the score is 1. If you're seeing that these curved ones are also 1 to 5, 1 organism, or maybe 2 or 3, the score also there is 1. So you add the 3, you add the 1 for lactobacilli, you add the 1 for Gardnerella, you add the 1 for mobilincus, you get a 3. Then you interpret these 3 using this criteria up here. So 0 to 3 is a normal flora. If you have added, maybe it's you have found your lactobacilli are 1 to 4, the score is 2. If you found your Gardnerella is 1 to 4, which is the score is 2, and your curved ones are above 5, the score is 2. You'll add 2 plus 2 plus 2, which is 6, and 6 here will be consistent with the intermediates. But if it's an intermediate and the presence of these clue cells here, they'll favor bacterial vaginosis. If it is less than 4, it's negative for bacterial vaginosis, which is a bacterial normal flora. And if it's anything that's above 7, maybe you have done your counting and it's above 7, it's consistent with bacterial vaginosis. And Apple, that's where you expect to see these kinds of clue cells. You can look at the clue cells, my friends. The person who was asking about the clue cells. They're just normal epithelial cells that are highly colonized by those bacteria. There are too many, and they're very ambiguous. That's how they appear on a gram stain, and I believe that there's a way they appear on a wet prep. This one is the wet prep, the one that's not stained, the one that's on your, I think, on your left. So that's how you can be able to tell them apart.
Thank you. Allow me to bring in back Fred or Bade to continue. And as he comes back, allow the presenter to answer our last question. That is, can sexual intercourse just immediately before the collection of the HVS interfere with the HVS quality and the reporting? Thank you.
Yes, that one will interfere with the quality, not the quality per se, but it will interfere with the results, because you'll entirely be finding epithelial cells there, and because of the, you need to find your bacteria where they are supposed to be. And now that this canal has just been interrupted a while ago, the flora has been disrupted, the bacteria that could be pathogens have been disrupted, maybe they've been removed from where they're supposed to be. So you do your sampling there, you might get epithelial cells in plenty, yes, but you will not get the bacteria that you intend to. That's why someone is supposed to abstain from sex for a while before they come for this particular sample collection.
Thank you so much to our participants. Thank you so much. As we bring back Fred to guide us on the way forward, we appreciate your efforts today, and we hope to see you in our next webinar. Thank you so much. My name is Athimari. Welcome, Fred.
Thank you, everyone. Thank you, everyone. Thank you, everyone, for the patience. Thank you, Baraza, for the presentation. It was wonderful. There are so many concerns about the slides. We shall share the slides on our WhatsApp group. We have pinned the WhatsApp link on the chat box. If you're not in any of them, kindly join. If you are in any of them, don't join that one. Just join the WhatsApp group for for our updates on real time. Now, I just want to say that there will be certificates that will be awarded from this webinar, and the certificates will be out within 3 days. So some will start receiving today, and some will receive up to the 3rd day. So just be patient, and you shall receive the certificate. Now, finally, we have many other webinars that are lined up for you. Just follow us on the WhatsApp page, and you shall receive all our updates on real time. Otherwise, it was nice having you. Have a nice evening.